Hi, I'm Dr. Todd Lizon from Lifestyle Integration. Today I'm going to be speaking with you about how the simple zinc supplement that you're likely taking could be creating harm. Now that's a hard thing to understand for a lot of people because we know that virtually every single person should be supplementing with zinc. When you look into the literature, it's very clear that everybody needs zinc to function optimally. Zinc is required for so many body systems, it's not even practical for me to list them through here. And we know that the experts are recommending that everyone really should be taking zinc, or most experts are recommending that everyone should be using some zinc. I put myself into that category. So why am I suggesting that the zinc that you're taking, if we should be taking it, might be creating problems? And the answer to that question lies in the mineral wheel. The mineral wheel is something that explains the interactions between minerals and vitamins. And there's a couple of concepts that you need to understand in order to wrap your head around why I'm saying that zinc alone is not ideal for everyone. The two concepts are synergistic and antagonistic relationships. Now, a synergistic relationship is simple to understand, and you already know an example of this. Most people know if you want to increase your absorption of calcium, you need vitamin D to help with that. They help each other. That's a synergistic relationship. Now, there also exists antagonistic relationships, and zinc is antagonistic to sodium, and that's the issue we need to understand. Zinc lowers sodium, and if your body is already low in sodium and you take zinc, you will further amplify the problem that exists. Now, the problem with low sodium is that sodium is a solvent. It keeps things in solution, and it's a critical solvent in our bodies to keep calcium in solution. And you're going to want to do that at the optimal level, because if calcium is precipitating, it's going to go into things like the arteries and create hardening of the arteries and then high blood pressure. It's going to go into the tissues, the tendons and the muscles, and create calcification in there, which creates stiffness and achiness. It may even go into the joints and create joint problems. So making sure that you've got a proper level of sodium is critical. And if the zinc supplement that you're taking is going to lower sodium, and you already have a low sodium, that is a problem. So what do we do? Well, if your sodium levels are adequate, take zinc. That's not a problem. If your sodium levels are low, you need to take something like this, which is called limcomin. And this is a blend of nutrients that work when your sodium to potassium, your sodium levels, are low. Now, the reason that this limcomin blend of supplements works is because the nutrients have the right balance of synergistic and antagonistic actions. So, for example, it has zinc, but it also has copper and manganese. And copper and manganese support and raise the sodium levels. That's why they're there. However, copper tends to antagonize zinc and push zinc down. And I know a lot of viewers will be very well aware of the effects that copper has on zinc and zinc on copper. So what does this particular blend of nutrients do that works so brilliantly? It includes things like vitamin A, C, and B6, which balance the copper. So when your sodium levels are low and you use limcomin as the supplement to get your zinc, you not only get your zinc, but you balance that sodium level and ensure that the zinc will be functional and fully used within your body. So in a nutshell, there you have it. That is why you should not recklessly be going out and just taking zinc because someone told you to. You may be right, you may be wrong. The way you know if you're right or wrong is by measuring. And the way you measure is not with blood tests. Blood tests do not adequately pick this up. It's with hair tissue mineral analysis, which you see here. In the first example that you see through here, you can see that the sodium level is low, and it's low relative to the potassium. That's why we use limcomin. Now in this opposite example that you see through here, you can see that the sodium to potassium ratio is high, where the sodium is high relative to the potassium. And in that situation, you use zinc. But the point is you must be measuring these things. Something I often say to my clients and patients that I work with is that if we want to acknowledge that supplements work, and they do, we need to acknowledge the reverse, that the wrong supplements at the wrong time can cause damage. And that's where I agree with medicine at times in that supplements can be damaging. We may not be having deaths from supplements, but we need to acknowledge that if they work, then the acknowledgement is that the wrong ones can also create harm. So there you have it. I've enjoyed bringing this topic to you today. I hope this really helps you in your assessment and measurement and decisions on zinc supplements. Should you have any questions, you can always email us at info@lifestyleintegration.com.au, or you can see some of the other links on our page through here. You can watch some of our other videos. Certainly subscribe to our YouTube channel that you can see up here on the top as well. And until next time, keep well.